Stop. Before you take your next blood pressure pill, watch this. If you or someone you love is taking Amlodipine, Losartan, or Lisinopril right now, there are things happening inside your body that your doctor may never have told you about. And I'm not talking about the side effects listed on the back of the bottle. I'm talking about hidden reactions, nutritional losses, and silent damage that builds slowly, day after day, until one morning, you wake up and something feels very wrong. Millions of seniors across the world take these 3 medications. They trust them, they rely on them, and most of them have no idea what we're about to share today. My name is Dr. Name, and for over 20 years I've worked with elderly patients managing chronic hypertension. I've seen what these medications can do, the good and the part nobody talks about. Today, we're counting down 5 critical things that seniors on blood pressure medication must know. We're going from number 5 all the way to number 1. And number 1? It shocked even some of my colleagues when the studies first came out. We're talking real science, real patient stories, and most importantly, real things you can do starting today. Now here's the question nobody asks their doctor. Is my blood pressure medication slowly robbing my body of something I desperately need? The answer is more complicated than you think. Stay with me, because by the end of this video, you'll understand your medication better than most people who've been taking it for years. And that knowledge, it could change or even save your life. Let's start the countdown. Number 5. Amlodipine is quietly draining your body of a critical mineral. Here's something most pharmacists won't put on the label. Amlodipine, one of the most commonly prescribed calcium channel blockers in the world, works by blocking calcium from entering your blood vessel walls. That's how it relaxes your arteries and brings your pressure down. Smart mechanism, it works. But here's the problem nobody talks about. When you interfere with calcium signaling in the body, you don't just affect your blood vessels, you affect your entire mineral balance. And over time, many seniors on amlodipine begin showing signs of magnesium depletion. Magnesium, the mineral responsible for over 300 biochemical reactions in your body: heart rhythm, muscle function, sleep quality, nerve signaling, energy production. All of it depends on magnesium. And when it drops, slowly, silently, the symptoms don't scream at you. They whisper. Leg cramps at night, feeling tired no matter how much you sleep, a little more anxious than usual. Heart flutters that come and go. Sound familiar? I had a patient, 71-year-old retired schoolteacher named Margaret. She came to me exhausted, cramping every single night, couldn't sleep. She thought it was just aging. It wasn't aging. Her magnesium was critically low. She'd been on amlodipine for 4 years, and nobody had ever checked her magnesium levels. Not once. We made one simple change: a magnesium glycinate supplement, 200 milligrams at night, and within 3 weeks, Margaret was sleeping through the night for the first time in years. The fix? Ask your doctor to check your serum magnesium levels at your next visit. If you're low, magnesium glycinate is gentle on the stomach and highly absorbable. Always check with your physician before adding any supplement. But stay with me because number 4 affects people on Losartan and Lisinopril specifically, and it involves something you eat every single day. Number 4, Losartan and Lisinopril can make potassium dangerously high, and nobody warned you. This one goes in the opposite direction, and it can be just as dangerous. While amlodipine may deplete certain minerals, Losartan and Lisinopril, both part of a drug class that blocks a hormone called angiotensin, actually cause your kidneys to retain potassium. That sounds fine. Potassium is good, right? Not when there's too much of it. A condition called hyperkalemia, high potassium in the blood, can develop quietly in seniors on these medications. And the scary part? The early symptoms are almost invisible. Mild weakness, occasional tingling in the hands, feeling a little off. But when potassium climbs too high, it disrupts your heart's electrical system. We're talking irregular heartbeat. In severe cases, cardiac arrest. Here's what makes this worse for seniors specifically. As we age, our kidneys naturally become less efficient at filtering, so the potassium retaining effect of Losartan and Lisinopril hits older patients much harder than younger ones. A 2019 study published in the Journal of the American Geriatric Society found that seniors over 65 on ACE inhibitors, or ARBs, like Lisinopril and Losartan, were significantly more likely to develop dangerous potassium levels, especially when combined with a high potassium diet. And what's a high potassium diet? Bananas, oranges, potatoes, tomatoes, spinach. Foods we've always been told are healthy. I had another patient, a 68-year-old retired engineer named Robert, healthy eater. Every morning, a banana, orange juice, and spinach smoothie. His cardiologist had never mentioned potassium. He came in with chest discomfort and weakness. His potassium was dangerously elevated. One dietary conversation changed everything. The fix? If you're on Losartan or Lisinopril, talk to your doctor about getting your potassium levels checked regularly. Be mindful of high potassium foods, not eliminated, just monitored. Balance is everything. Now, we're only at numbers 5 and 4. And already you're learning things that could protect your heart, your sleep, and your life. But numbers 3 and 2, they get more serious. One involves a side effect that's been misdiagnosed as a new disease in thousands of seniors. And the other involves a dangerous drug interaction hiding in your medicine cabinet right now. Number 3, the side effect being misdiagnosed as a new disease. This one makes me angry every time I see it. And I see it more than you'd think. Lisinopril and all ACE inhibitors work by blocking an enzyme called ACE. That enzyme normally breaks down a substance in your body called bradykinin. When you block ACE, bradykinin builds up. And in roughly 1 in 5 seniors on lisinopril, that buildup causes one of the most frustrating, quality-of-life destroying side effects in all of cardiology medicine. A chronic dry cough, not a cold, not allergies, not early signs of heart failure, a persistent, tickling, won't-go-away cough that shows up weeks or even months after starting the medication. Now here's where it gets troubling, because that cough sounds like something. It feels like something, and when a senior walks into a clinic coughing, doctors start testing, chest x-rays, pulmonology referrals, allergy panels, GERD evaluations. Thousands of seniors every year are being worked up for respiratory disease, when the answer was sitting in their pill organizer the entire time. I treated a 74-year-old woman named Dorothy. She'd been coughing for 8 months. She'd seen a pulmonologist, an allergist, and an ENT specialist. She was diagnosed with probable early COPD and given an inhaler. She didn't have COPD, she had a lisinopril cough. We switched her to Losartan, an ARB that works similarly but does not cause bradykinin buildup, and within 6 weeks the cough was completely gone. 8 months of suffering, 3 specialists, 1 unnecessary diagnosis, all because nobody connected the dots. The fix? If you've developed a new persistent dry cough since starting lisinopril, tell your doctor immediately. Don't accept it's just aging or let's investigate your lungs before exploring a simple medication switch. This is one of the most well-documented drug side effects in medicine. You deserve that conversation. But as serious as that is, number 2 is where things get genuinely dangerous. Because this one isn't about what your medication does to your body alone. It's about what happens when it meets something else. Number 2, the hidden drug interaction. Sitting in your medicine cabinet right now. Picture this. Your knees ache, your back hurts. It's a rough morning. So you do what millions of seniors do every single day. You reach for ibuprofen, Advil, Motrin, Aleve. Whatever's in the cabinet, it's over the counter. It's familiar. It feels safe. It isn't. Not anymore. Not with your blood pressure medication. NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen and naproxen, have a direct and dangerous interaction with all 3 medications we're discussing today. Amlodipine, Losartan, and Lisinopril. Here's what happens inside your body when you combine them. NSAIDs cause your kidneys to retain sodium and water. That raises blood pressure. directly counteracting everything your medication is working to do. But it gets worse. When combined with Losartan or Lisinopril specifically, NSAIDs can trigger something called the triple whammy effect, a term actually used in nephrology literature. The combination of an ARB or ACE inhibitor, a diuretic, and an NSAID can cause acute kidney injury, sometimes within days. A landmark study published in the British Medical Journal found that seniors taking this combination were 31 times more likely to develop acute kidney failure compared to those taking none of these drugs. 31 times, not 31% more likely. 31 times. I want you to really sit with that number. I had a patient, 77-year-old grandfather named Harold, healthy man, active. He had knee surgery, experienced post-op pain, and took ibuprofen for 2 weeks alongside his Losartan and water pill. He ended up in the hospital with acute kidney injury. His creatinine levels had nearly tripled in 14 days. He recovered, thankfully, but his kidney function never fully returned to baseline. All from a painkiller he thought was harmless. The fix? If you need pain relief and you're on blood pressure medication, please talk to your doctor first. Acetaminophen, Tylenol, is generally a much safer alternative for pain management in this situation. Avoid ibuprofen and naproxen unless specifically cleared by your physician. And always, read the labels on over-the-counter medications before combining them with prescriptions. Now, we've covered numbers 5 through 2, mineral depletion, potassium dangers, a misdiagnosed cough, a deadly painkiller interaction. But number one is the one that changes everything. It's the finding that senior cardiologists are now calling one of the most underappreciated risks in blood pressure management today. It involves your brain, your memory, and a silent process that may already be underway. Number 1. What your blood pressure medication may be doing to your brain. I need you to pay very close attention right now, because this is the part of the video that made several of my colleagues uncomfortable when I first brought it up, not because it's wrong, because it's right, and the implications are enormous. Here's what we know. Your brain is one of the most blood flow dependent organs in your entire body. It consumes 20% of your body's total oxygen supply. It needs constant, consistent, perfectly regulated circulation to function properly. And here's the critical thing most people don't realize. When you take blood pressure medication, especially as a senior, your goal is to bring those numbers down. That's the whole point. But in elderly patients, there is a delicate and dangerous line between healthy blood pressure control and blood pressure that drops too low. A condition called orthostatic hypotension, where blood pressure drops suddenly when you stand up, affects an estimated 30% of seniors on antihypertensive medications. You've probably felt it, that brief dizzy spell when you get up from the couch, the moment where the room tilts slightly, where you grab the nearest wall. You probably thought nothing of it, but here's what's happening in that moment. Your brain is being temporarily starved of blood flow. Oxygen delivery drops. And while one episode may seem harmless, repeated episodes happening daily, over months and years, are now being linked to something far more serious. Accelerated cognitive decline. I want to say that clearly so it lands properly. Repeated drops in cerebral blood flow, triggered by over-aggressive blood pressure lowering in seniors, may be speeding up memory loss, cognitive impairment, and early dementia. This is not a fringe theory. A landmark study from the Journal of the American Medical Association followed over 4,000 older adults and found that seniors whose blood pressure was lowered too aggressively had significantly faster rates of cognitive decline compared to those with moderate blood pressure control. Another major study from JAMA Internal Medicine found that episodes of low blood pressure in seniors were directly associated with increased brain lesions. Areas of damaged tissue visible on MRI scans, linked to memory loss and thinking problems. Let me say that again. The medication meant to protect your heart may, when not carefully monitored, be quietly injuring your brain, and the symptoms don't come with a warning alarm. They creep in, slowly, disguised as normal aging, a little more forgetful than last year, taking longer to find the right word, feeling mentally foggy in the afternoons. Families chalk it up to getting older. Sometimes it isn't age at all yet. I think about a patient I'll never forget, a 79-year-old retired professor named William, sharp man, crossword puzzles every morning, called his grandchildren by name without hesitation. His daughter brought him to me because in the span of 18 months, he had changed. Slower, confused at times, forgetting conversations he'd had the day before. His previous physician had aggressively lowered his blood pressure to textbook perfect numbers, 115/70, impressive on paper. But William was standing up and nearly blacking out 3 times a day. His brain was not getting what it needed. We carefully adjusted his medication regimen, slightly relaxed his blood pressure targets to age-appropriate levels, added positional guidance for standing, addressed his hydration. Over the following 6 months, William started doing his crossword puzzles again. His daughter cried in my office. She said, "I thought I was losing my father. I didn't know it might be his medication." And that moment, right there, is exactly why this video exists. The fix? The target blood pressure for a 75-year-old is not the same as for a 45-year-old. Research now supports slightly higher blood pressure targets for seniors, often 130 to 140 systolic E, to maintain adequate brain perfusion. If you're experiencing dizziness upon standing, mental fog, or increasing forgetfulness, do not ignore it. Bring it to your doctor. Ask specifically, is my blood pressure being managed at age-appropriate targets? Ask about your medication timing. Ask about hydration. Ask whether your current dosage needs reevaluation. This is not about stopping your medication. Blood pressure control saves lives. It prevents strokes. It protects your heart. But how it's controlled and how carefully it's monitored in older adults matters profoundly. You deserve a doctor who treats your age, not just your numbers. You deserve to protect your heart and your mind. And now, you have the knowledge to demand exactly that. You made it, and that matters more than you know. Take a breath, because what you just learned in this video? Most people on these medications will go their entire lives never knowing any of it. But you know it now, and knowledge, real, science-backed knowledge, is the most powerful medicine there is. Let's bring it all together, because this isn't just a list, this is a roadmap. Your roadmap. Starting today. Number 5. Magnesium depletion from amlodipine. If you're on amlodipine and you're experiencing night cramps, poor sleep, fatigue, or heart flutters, your magnesium may be low. Ask your doctor to test your serum magnesium levels. Consider magnesium glycinate under medical guidance. One simple test. One simple conversation. Potentially life-changing results. Number 4. Potassium buildup from Losartan and Lisinopril. If you're on either of these medications, your kidneys may be holding on to too much potassium, especially if your kidneys aren't working at full capacity. Monitor your diet. Get your potassium levels checked regularly, and don't assume that because a food is healthy, it's automatically safe with your specific medication. Number 3. The Lisinopril cough misdiagnosed as lung disease. If you've developed a persistent dry cough since starting Lisinopril, speak up. Don't let it be dismissed. Don't accept a new diagnosis before exploring a simple medication switch. Losartan is a well-established alternative. 8 months of suffering, like Dorothy, is 8 months too long. Number 2. The deadly painkiller interaction. Remove ibuprofen and naproxen from your automatic go-to list for pain. Right now, today. If you're on Losartan, Lisinopril, or even Amlodipine with a diuretic, NSAIDs are not safe casual pain relief anymore. Talk to your doctor about acetaminophen. Talk about other options. Your kidneys are depending on you to make that call. Number 1. Over-aggressive blood pressure, lowering and your brain. This is the big one. If you are over 65 and experiencing dizziness when standing, increasing forgetfulness, mental fog, or fatigue, your blood pressure targets may need reassessment. Print this out if you have to. Bring it to your next appointment. Ask your doctor directly, are my blood pressure targets appropriate for my age? You are not being difficult. You are being your own best advocate. Here is your action plan. 5 steps, starting this week. Step 1. Schedule a blood work panel, specifically requesting magnesium, potassium, and kidney function markers. These are standard tests. You have every right to ask for them. Step 2. Write down every symptom you've been brushing off as just aging. Leg cramps, brain fog, dizziness, dry cough, fatigue. Bring that list to your doctor. Don't minimize it. Don't forget it. Write it down. Step 3. Check your medicine cabinet today. Remove or set aside any ibuprofen or naproxen products. Replace them with acetaminophen after clearing it with your physician. Step 4. When you stand up, pause. Sit on the edge of your seat for 5 seconds before rising. Let your body adjust. This one simple habit can dramatically reduce dangerous blood pressure drops and protect your brain every single day. Step 5. Share this video right now with your spouse, your sibling, your adult child, your friend who just started blood pressure medication. Because the person you share this with today might be the person whose life changes because of it. You are not just a patient. You are a partner in your own care. The medical system is busy. Appointments are short. Doctors are stretched thin. That means the most important person in charge of your health is you. Not because the system failed you, but because you now have something most patients don't. You have context. You have questions. You have a voice. Use it. Blood pressure medication has saved millions of lives. It can save yours too, but only when it's monitored carefully, adjusted thoughtfully, and combined with the kind of awareness you now carry walking out of this video. You came here for information. You're leaving with a plan. And that, right there, is how seniors thrive. Not just survive, thrive. Before you go, I have one question for you. Drop it in the comments right now. Which of these 5 facts surprised you the most? Was it the magnesium depletion, the potassium danger, the misdiagnosed cough, the painkiller interaction, or number 1, the connection between blood pressure medication and brain health? Tell me below. Your answer helps me create more videos that actually matter to you and your family. And if this video helped you, please hit that like button and subscribe, because every week we bring you real medical information explained clearly so that you can live longer, sharper, and stronger. Thank you for watching. Take care of yourself, and I'll see you in the next one.